Hi, my name is Eleanor Tatum, and I'm the publisher and editor-in-chief of the New York Amsterdam News. The coronavirus crisis has brought serious distress to local economies and advertising along with them. The New York Amsterdam News has partnered with the Local Media Association during this unprecedented crisis. Help us continue our important work in chronicling the life of Black New Yorkers and consider making a donation to the COVID-19 Local News Fund today. Go to givebutter.com/Amsterdam News. Again, that is givebutter.com/Amsterdam News. Thank you and stay safe.
It's Monday, April 27th, and welcome to the New York Amsterdam News Podcast. I'm Cyril Josh Barker. We continue our coverage of the COVID-19 outbreak with my guest, Dr. Kitaw Demissie of Downstate Health Sciences University School of Public Health. He's going to be speaking with me about the latest developments in the coronavirus crisis. It's been nearly 2 months since the first confirmed COVID-19 case hit New York City. As of April 27th, over 156,000 people have been infected with the virus, and nearly 17,000 people have died. The CDC recently confirmed new symptoms of the virus, including sore throat, headache, and muscle pain. Stay-at-home orders remain in place in New York while some states begin to reopen, and we welcome you to this episode of our podcast. My guest, as I said before today, is Dr. Kitaw Demissie, who was actually with us about a month ago to talk with us about COVID-19 in March. And of course, as you know, a lot of things have changed since then, and so we're definitely going to be talking with him about some of the new things that are going on with COVID-19. As I said, new symptoms were actually confirmed today by the CDC, and so we're going to be definitely talking about that. I have a huge announcement to make, and that is the announcement of our new website for the podcast. You can now look at the podcast, or rather hear the podcast, at amnewspodcast.com, and there we have all of our podcasts that we've done, and it's also mobile friendly, so you can take it on the go with you. One of the things is we're going to be having this as an archive so that we can document this very important time, so hopefully you look at it. As you also know, there's a big story going on right now. A lot of you guys read it on our website, and it's the story about Bill de Blasio's wife being appointed, Charlene McCray being appointed as head of the COVID-19 Racial Equity Task Force. And so we definitely want to engage you in that story, and we hope you read that. It was a huge story on our Facebook page, and we're going to do a little more about it this week in the paper. You can look out for that on Thursday. I have to give a big shout out to Chill Hop Music. I know it's kind of weird, but one of the things that I was getting, people were telling me about this podcast, friends and family that listen to it, is that there's really no music. We have music in the beginning of the show, but nothing in between. And so that beat that you just heard is by Chill Hop, and we're going to tell you who the artist is, and if you want to connect with that person. Chill Hop, I'm a big fan of them for many years. Listen to them when I'm working, and we were really appreciative to them for them to allow us to use their music. And so I told them I'd give them a little shout on here. You can go to chillhop.com. They actually also have a 24-hour live stream music station, or rather channel on YouTube, and it's really cool. So hopefully you listen to it. So big shout out to Chill Hop. We love you. Well, my guest this week is Dr. Kitaw Demissie, who is Dean and Professor at Downstate Health Sciences University School of Public Health. He's on the phone with me to discuss developments in the coronavirus and what's ahead. Welcome to the podcast, Dr. Demissie. How are you?
Good morning, Josh. How are you?
I'm doing fine. Thank you so much. So it's been about a month since you were with us last time. The pandemic has had its ups and downs, mostly ups in terms of the cases that have gone up since the last time we spoke a month ago. Kind of give me your analysis of where we are with this on the health side. And there were some new symptoms that were announced recently, so I just want you to talk a little bit about that.
Yeah, so I think overall the mitigation instructions have been really successful because of social distancing and also people staying at home. The epidemic is really plateauing or going down now. The number of cases who are newly infected is going down. Hospitalizations are in general going down. The number of people who need ICU beds and also intubation is going down. So overall, I think it's very promising that we are seeing a decrease in the incidence or in the occurrence of new cases, and also those who are hospitalized. Mortality or death rate is also going down. Still, it's very high. A lot of people are still dying, but it's in the downward trajectory, which is really encouraging now.
All right. And I know that today there were some new symptoms that were announced. Well, not today, over the weekend, rather. There was some new symptoms that were announced. Tell us a little bit about how that works, because we've been in this pandemic for about a month now, and they're now announcing to us new symptoms that are coming with COVID-19, including lack of taste and smell, which I had actually known about before, and then also there's chills and other things. Tell us about the evolution of this pandemic, and what, I mean, are these new symptoms that we're seeing, or is this just based on studies that people have done?
Yeah, I think, this is a new virus. We are learning everything, every time new things. But the common symptoms is still the majority of people present themselves remain the same, which are fever, dry cough, chest pain or pressure, shortness of breath, tiredness are the major symptoms. And then people also can have aches and chills, runny nose, nasal congestion, sore throat. And in very rare cases, diarrhea is another symptom described. But as we learn new things, there are new symptoms like COVID tolls in children, and new manifestations always come, similar to when HIV was first started. The common symptoms were loss of weight and so forth, but later on, we knew that HIV presents with enlarged lymph nodes and affects the eye and so forth. So, in the same way, with COVID-19, we'll be learning new symptoms and new manifestations with the disease. So it's just the beginning of seeing new symptoms, but my expectation is these things will grow. We'll learn every day the manifestations of COVID-19 will have different characteristics and symptoms. So it is expected in medicine that these things evolve. But the most important thing is, people should be really be aware that if they have trouble breathing, persistent pain or pressure in their chest, and if they have symptoms of confusion, which came new, and having bluish lips or face, those are the most important symptoms that indicate that they need to seek medical attention immediately. But the other symptoms are also important. A lot of the patients, as will recover about 80% without major illnesses. But the symptoms I mentioned earlier are indicative of serious illness, which requires medical attention.
All right. We're seeing a lot of the cities around the nation that are kind of relaxing the social distancing rules, opening up businesses. We're seeing hair shops open in Atlanta. We're seeing just different things, happen in different cities. Obviously, not here in New York City. But tell me about what you think about that. And is it too early? I mean, are we just jumping the gun here on some places when it comes to the social distancing?
Yeah, you see, the main thing the main indicators to open up and go back to work is, at the beginning when the epidemic started, before a lot of people got infected, if you have a good infrastructure like tracing and isolation, quarantining people, the disease wouldn't really have reached this level to begin with. But once it is largely spread in the community, then the only thing you need to do is mitigation, like closing of businesses, social distancing, and not allowing people to come out of their houses and so forth. Now, the trick is to go back and reach a level of infection that is before mitigation, or the number of infections in the community should be really very small in order to start opening up these businesses and work and coming back to life. But for all these things, you need, in addition to really decreasing the infection, you need a good public health infrastructure whereby you do testing, and testing is not only for the people who come because of symptoms, but randomly you have to take random population samples and do testing even among those people who are not ill to understand the extent of the disease in the community. And once you understand that the level of infection is very low in the community, you have to have really a system and infrastructure whereby you will be able to contact and trace those people who are infected and the people whom they have contact with within the last 2 or 3 weeks before they were infected. In that case, you can really identify and isolate those people who are in close contact with the infected individuals, and you'll be able to really control the epidemic. At that time, you can be really sure to open businesses as usual and also back to the usual. But none of these things are happening anywhere for that matter. Leave alone Atlanta, Georgia, where the infection rate is really going up, in the middle of this opening is like really calling for trouble. My prediction is the infection rate will increase in places like that. And again, there will be a wave of infection and they will be forced to close at one time in the future again. So it is a very premature action that they are taking these places. But the most important thing is to really be prepared to have contact tracing, and before that you have to really decrease the level of infection in the community significantly. And some people talk about they will use the antibody test to monitor the infection, but I don't believe the antibody test is the right way of doing it, because the antibody test tells you if somebody is positive with that test, it tells you really that person has been infected 2 months before or 2 weeks before or 3 weeks before. It doesn't really tell you what is happening in the community, what is the infection rate in the community, how it is spreading in the community. So it's really lags significantly behind the current infection, and you can't use that to monitor the rate of infection, what is going on currently. On the other hand, the antibody test, we don't even know if it gives complete protection, but if that is the case, what will tell you is when it reaches about 80%, then we know that there is herd immunity or group immunity in the population. At that case, the outbreaks are likely to break out. But currently, the random sample from groceries, it's not really random, but grocery samples that the governor presented a few days ago gives you an infection rate of about overall about 13.9 or 14%, and in New York City about 22%. But even those numbers are very, very small in order to achieve herd immunity. As I said, herd immunity that will prevent the spread of the disease should be close to about 80%. At least above 75%. We don't know. For measles, it's about 95%, 96%. But for COVID, our suspicion is it will be about at least 75% and above.
All right.
So, in general, to answer your question, I think a lot of the places are doing these things prematurely. And I don't see really a very, sophisticated and intelligent plan how to open, you businesses and to bring back people to work. It's just everybody seems that they have their own way of doing things. There isn't really a coordinated effort. And in addition to that, I don't see a very, very organized system of reopening. I think I can understand their pressure because the economy is bad, but despite that, I think they can do a better job in really organizing and intelligently planning how to open by preparing the infrastructure, the healthcare, the Department of Health and the community can really come together and train community health workers to really do the contact tracing in a lot of public health schools, including SUNY Downstate School of Public Health, can do training of these people to really be involved in contact tracing and isolation. And these people, there is a lot of unemployment at the same time.
Right.
It would help people to get employed also in this. So there are a lot of things that can be done, but the things that I see is so fragmented. And in some cases, the experts are not really, I don't see experts a lot, or public health experts, even on TV and radio, who will come and talk about these things. You see people sometimes who doesn't have really the knowledge of public health and the experience and strategy to really control this type of epidemics. So it is a very haphazard all over the place.
All right. One of the things I wanted to ask you about was we keep hearing the term contact tracing. Can you give people an idea of what that is exactly? A lot of people are kind of skeptical about it. Will it work? But what does that term mean?
Yeah. So in public health, if you want to control diseases, you have to use a surveillance system. Surveillance system is a way of identifying people with a particular infectious disease or non-infectious disease, which is a threat to the community, then be able to monitor the number of people who got those infections. And at the same time, when you know that a person has the infection, then immediately identify that person and ask that person within the last 2 or 3 weeks with whom he had contact with whom he had dinner, with whom he was in a restaurant, with whom he had a close contact, and those people are at risk of developing or contacting the disease. And then you test those people, and among those who are positive, then you again trace their contacts and go on. So in that way, once you identify the contacts of the people who are infected,
okay,
and be able to isolate them, then the disease spread will diminish significantly. But as I said at the beginning, you will be effective in doing contact tracing when the number of infection in the community is small. If a large number of people in the community are affected, it's impossible to do that. That's why they are doing mitigation now, which means, nobody should really go out of the house. Nobody should really do this or that. But if you start doing the surveillance system early, when you hear in China that the disease outbreak is there, then we wouldn't have reached this level of disaster. Now, the only way you can really do contact tracing and isolation is the infection rate should decrease significantly in the community. Then when it is low and the transmission from person to person is 1 to 1 instead of 1 to 2, 1 to 3, 1 to 4, then you'll be able to contact trace these people and isolate them effectively and control the spread of the epidemic. In that case, you can allow people to back to work. That's the way it should be done.
Right.
But I didn't see anywhere that there is an infrastructure development in terms of really training people for this purpose. And I haven't seen a lot of places doing the contact tracing, and most of them are actually running into opening before even controlling the infection. So that's where the problem is. So in places like New York, definitely they should prepare in terms of contact tracing, developing the public health infrastructure, which has not been there before. And also there are a lot of community organizations that you can work with, and they have a lot of people they can recruit to be trained and help their own community in contact tracing and isolation. And you need a lot of also infrastructure issues with that, because if you take my population, a black, majority black and Latino population,
right?
Most people, their houses are really overcrowded.
Mm-hmm.
And if one of the family members is ill or infected, once he's positive, you tell him to isolate himself in the house in a one room where he has 4 kids and maybe an elderly mother. How is he going to isolate himself?
Exactly.
I mean, you have to really prepare, open places like schools or gyms or whatever, which we're not using now, to isolate those people. Even hotels, you could use those to isolate people and give them, primary, basic kind of health care.
Okay.
Checking the temperature and this and that, and at the same time give them food also. So these to quarantine them. When these people test them again after 14 days, if they are negative, tell them to go back to their home. Otherwise, if you tell them they are positive and go home and isolate yourself, when the person has only one room house in New York City,
mm-hmm.
Public house, crowded housing, how are you going to prevent what is quarantine there? The family will be infected. Even those patients who are coming out of the hospital for COVID-related diseases, you are sending them home to infect their family members. So there are a lot of things that can be done if they are wise. But as I said before, everything is very fragmented.
Okay. One of the things I also wanted to ask you about is that the military boat, the USS Comfort, was actually sent back. And I'm gathering just by what I'm seeing on the news is that COVID-19 is not devastating our healthcare system as we thought it would. Is that true? Are we still, because one of the things we talked about a month ago was that you said that the hospitals would become overcrowded. We're not seeing that as much. They are crowded, and there is still a need for more beds, more healthcare workers. But did we get overwhelmed like we thought we would, or are we still not over that hump yet?
Yeah, it was overcrowded, and it was very scary, to be honest with you.
Oh, yeah, absolutely.
Yeah, and, we were almost on the verge that we cannot really afford any more patients.
Mm-hmm.
If you take SUNY Downstate, one of the only COVID hospitals in New York City, the number of cases that are coming was huge. The number of ventilators, we never came short of ventilators, but we were almost there not to have ventilators. So I think there was a lot of threat that you'll not have enough bed facilities, or you'll not have enough ICU rooms and ventilators to save these people. And we were planning actually to have other facilities and hospitals in different places in addition to SUNY Downstate. But because of the mitigation efforts that are put in place, the overall hospitalization is decreasing, and the number of people who are treated and leaving the hospital is reasonably good. So because of that, we are not short of ventilators, we are not short of beds and so forth, but we are almost on the verge of it.
Mm-hmm.
And if another wave of this condition comes again, it's possible that we can be overwhelmed also. So that's why you need to really do the contact tracing, the surveillance system very well to really learn from our experiences and avoid future disasters in the event of a fall wave or a subsequent wave of COVID-19 patients.
Okay.
So it is very important to really think about those things, because the healthcare system can be overcrowded very, very quickly. That's why I'm fearful in most of the places like Georgia, where the infection rate is still increasing, and now they are opening everything.
Yeah,
the infection
we're seeing
rate
that.
can go very high, and a lot of people can be overwhelmed.
Yeah.
A lot of people can be sick, and the healthcare system can be overwhelmed in a very short period of time.
Mm-hmm.
So
Okay.
the measures, the mitigation measures, particularly the shutdown, really helped to minimize and fight, the overload of the hospitals.
Mm-hmm.
We were almost at the maximum capacity.
Yeah. Okay. Finally, I just want to ask you, the mayor has implemented, the Governor Cuomo has implemented that everybody wear the mask out when we're in public, especially on public transit. But one of the things I wanted to ask you about is what other steps can people take to keep from getting sick? If they have been sick, what should they be doing? And just your final words on your advice for people to just stay healthy right now.
Yeah, I think, I was driving from work to take my car, I see a lot of people in apartments behind the garage I park. A lot of youngsters, getting together and having like a drink on balconies. That's fine, but the problem is when people come together, they transmit the disease. So I think we should really understand that and avoid bringing a large group of visitors into their home. That's really important. I mean, if you invite 10 people or more people in your house and have a party, I don't know how you are, really implementing social distancing.
Right.
So those are important things that they should do. And in addition to that, as much as possible, still, the best thing is not to go out until the closure is lifted. But if they go out to buy stuff and so forth, they have to. I go to grocery sometimes with my wife, and we put our mask. We cut even our hair with a plastic kind of shower hat kind of thing, and we put some kind of an eyeglass, and at the same time we put gloves. When we pick up things, the glove will protect you, and you have to really keep distance of 6 feet in groceries also from people. A lot of people don't care. They will come closer to you.
Yeah, I've noticed
very
that.
Polite.
Yeah.
Yeah, you can politely tell them, please, 6 feet is what is recommended. It would be nice to respect that. Without being confrontational, you can really politely tell them. And, immediately when you reach to the groceries, you can really use bleach they give you some kind of disinfectant to clean the cart that you are using.
Right.
But after you bring the food and everything to home, you have to really take very carefully your gloves, your hat, and your eyeglass and mask and everything. Then wash whatever things you can wash with a soap. Cans, and this can be washed easily. I do it all the time.
Okay.
Then change your clothes because you have touched something there. And in the meantime, you have to be careful not to touch your nose, eyes, or anything until you clean yourself. After you remove your clothes, put it for washing and clean yourself and wash your hand, wash your face with soap, and change clothes. You feel much better in that way. And in the house also, it's always good to disinfect areas in the house, like handles that usually people touch, and cell phones, remote controls, using some, disinfectants. You can clean those things. And, you have to avoid crowd as much as possible. And, if somebody is sick in the house, that is very tricky, as I said, especially in minority communities where there is crowding in the house. Isolation and quarantining will be very difficult.
But absolutely.
Not sharing, utensils, avoid sharing items for drinking, and this would help to minimize those things. But the community need to work together how we can isolate these people and give them a better place and facility. So I'm actively working on that. I don't know whether I will be successful or not, but I can report sometime. But in hospitals also, if they have questions, there is a call center at Downstate. They can use the phone number 718-270-2120, 718-270-2120 to get information. A lot of our medical students actually give information on the disease, and also if they have somebody admitted to the hospital and want to get some information, also they can help them get information to their loved ones. So they can do a lot of things to really help themselves. And in situation where there is no water to wash your hand, but if your hand touches surfaces, if you have some alcohol, rubbing alcohol, 70% isopropyl alcohol will be good to wash. I know that these things are very difficult to find.
Yeah, they are.
So the best strategy is soap and water will do more effective job than anything. So if they wash continuously their hand with soap and water, that will be very useful. And if they are in a train or public transportation, my advice is for them to avoid touching their eyes or face before they wash. So they have to be consciously looking not to touch their face and their nose and eyes until they reach to a safe place where they can have a soap and water and wash their hands thoroughly for about 20 seconds.
All right. Well, listen, Dr. Demissie, you've always given us some great advice when it comes to this, and we're definitely going to follow up with you again. We thank you so much for being on the podcast.
Thank you. I really appreciate it. Thank you.
That concludes this week's podcast. You can pick up the latest edition of the New York Amsterdam News on newsstands and get updates online at amsterdamnews.com. You can also keep up with us on Facebook at NY Amsterdam News and follow us on Twitter at NYAmNews. I'm Cyril Josh Barker. Thanks for listening.
Hi, my name is Eleanor Tatum, and I'm the publisher and editor-in-chief of the New York Amsterdam News. The coronavirus crisis has brought serious distress to local economies and advertising along with them. The New York Amsterdam News has partnered with the Local Media Association during this unprecedented crisis. Help us continue our important work in chronicling the life of Black New Yorkers and consider making a donation to the COVID-19 Local News Fund today. Go to givebutter.com/Amsterdam News. Again, that is GIVEBUTTER.com/Amsterdam News. Thank you and stay safe.